Okay, so my children tell me I'm supposed to talk about things on my backup that I wouldn't necessarily talk about in detail on my main. So I thought I would just tell you how my morning went. Some of you know, if you subscribe to my YouTube channel, that I have familial hemiplegic migraine disorder. It is obviously an inherited migraine disorder, hence the name familial. So hemiplegic migraines are migraines that mimic a stroke. The left side of my face gets like slumpy, and my left arm gets numb, tingly, and uncoordinated. I have a hard time getting my left hand to do what I want when I'm having a migraine. And sometimes those neurological impacts can last for days afterward, after the head pain is gone. I also get an aura. It's always in the left side. It looks like broken glass, kind of like a C shape, just in my left eye. That is part of the prodrome, the precursor to the migraine. So for me, like the head pain, the nausea, the vomiting, and sensitivity to light, that all really, that blows, right? But it's the lingering neurological symptoms that have a lot greater impact on my daily life. So those lingering neurological impacts, some of them have caused permanent nerve damage in the left side of my face. But also, when you're in the midst of a migraine like this, and again, sometimes the postdrome can last several days after, there can be continued cognitive impairment. And for me, it's not necessarily really like brain fog. I tend to get garbled speech. There's some instances of kind of famous news reporters who have exhibited this live on television when they have a migraine, but usually the wrong words will come out of my mouth or a word will come out garbled. It won't be every single word. And also, I will believe that I said the right word. I won't know that I'm talking nonsense or I'm using the wrong word until I go and look at the footage or my husband corrects me. It's usually something that is sort of related. So if I don't garble the word, I'll say a related word. I'll say tea when I mean coffee, bicycle when I mean minivan, laundry when I mean the dishes. So for me, I get Botox every 12 weeks. I get a lot of it in my face here, up here, around here, on my shoulders, down the back of my neck. And that has significantly improved my quality of life and reduced my migraine episodes from anywhere from 8 to 15 a month. Sometimes I couldn't tell where one migraine ended and the next began, which really sucks if you not only have to work and run your own job, but are also like raising children and have to drive a car. And also at the time that this really was the peak of my migraine problems, I was an athlete and I was skating 5 or 6 days a week. And sometimes I would get a migraine aura in the middle of scrimmage. And I'd be like, that's it, I guess I'm done for now. Because I know in 30 minutes, I'm not going to be able to feel my left hand or the left side of my face. And I'm not going to be able to keep exercising under these lights, right? So I failed 3 other medications before my insurance approved Botox. And then since then, a new rescue medication has come out, an abortive medication called Ubrelvy. And the times I do have breakthrough headaches, it is life-changing. I don't get the headache pain, but it does not abort all of the neurological symptoms. So I try really hard to have the preventive meds, the Botox, and then a rigid sleep schedule, eating schedule. I try to moderate my caffeine intake. A moderate amount of caffeine can help with migraines. So yeah, I just thought I would share. I went and got a whole head full of Botox today, and I often get a rebound headache, and I've noticed that I have some numbness on the left side of my face. I'm not getting like huge face drooping, but I've also been having a little bit of trouble with my speech today. So not like a full rebound migraine, but it definitely can trigger those neurological symptoms. I think for folks who don't deal with complex migraines, they sometimes think it's just a headache when actually it is a complex neurological disorder that also increases the type of migraine that I have, puts me at an increased risk for stroke as well. Obviously, I try to mitigate that risk. I don't smoke. I try to keep my stress level low as I possibly can. Thanks for listening, and thanks for following my backup. Thanks.